So many of us suffer from frozen shoulders nowadays. Doctor, what is your view on that?
So first of all, in order to understand frozen shoulder, you should have a basic idea regarding what is a shoulder joint. See, in a shoulder joint, you have a large bony part which is situated in a socket-like structure, and it is protected by a capsule structure. Okay, we call it as a shoulder capsule or the fibrous capsule. So because of any particular reason, like any sort of inflammation, or if the person is having systemic conditions like diabetes, or because of any trauma of any muscles which are supporting this shoulder joint, this can lead to the inflammation of this capsule, which is acting as the protective cover for the shoulder joint. Eventually what will happen, this capsule will undergo scarring. This scarring is called as adhesions. That means it is going to stick, it is going to paste this joint. Because of that, the patient will eventually start to develop restriction in the movement of his shoulder joint. Okay? That is actually considered as frozen shoulder. So this particular frozen shoulder, it goes through some stages. The first stage is considered as freezing, in which the patient will be having severe pain over the shoulder joint along with restriction of movement. Eventually, if the patient is not treated, it will go into the next stage, that is called as frozen stage. And in that, the patient will not be having much pain, but the restriction of movement will be more. And the peculiarity of this condition is, this is a self-limiting condition. That means the patient will come out of this eventually, but it will take a lot of time. Maybe 1 year or 2 years. Eventually the patient will come out of this. And the problem is, then that condition, that stage is called as thawing stage. So the frozen shoulder, as I told, it goes through 3 stages. First is freezing, then goes frozen shoulder as such, and then the last is considered as the thawing stage. So these are the 3 stages of the frozen shoulder. So depending on which level we treat the patient, that's how fast the recovery will be. The perfect condition that it is because the frozen shoulder is happening because of only this condition, that we can't say. It can happen because of multiple reasons. So that's something that you need to understand regarding frozen shoulder.
Doctor, would you like to add something?
Frozen shoulder, as doctor said, frozen shoulder may have secondary issues. In the sense, diabetic patients will have frozen shoulder. Those who have cervical spondylosis, they will have connect with the shoulder issues, and they will also shows the symptoms like a frozen shoulder symptoms. So what we used to say is that it's basically the kutra dosha affected over there. So what happens is that the kapham gets accumulated over that area and strikes that area. The chronic flow of the vadam is obstructed. So what we used to do is that we treat, the line of treatment will be like this. First we correct the kutra dosha. First we correct the kapha obstruction over there. For that we will do some manipulation therapy over there, and we will stimulate some varma points over there. Actually there are 6 varma points over the neck and shoulder area. One is Pedaricalam, another one is Kaikakate varmam, and Kaikauli varmam, Puja varmam, Akul varmam, like that so many varma points are there. Usually we used to stimulate the varma points, and we advise the patient to do some lifestyle modifications also. With that we can manage the cases.
So what is the Ayurvedic approach to
in Ayurveda also we also have a similar kind of similar approach. The condition that we correlate frozen shoulder is called as Ababahuga. So in this, the doshas involved are Vata dosha and Kapha dosha. So the line of management will be to eliminate the increased Kapha dosha and Vata dosha, and to bring back the normalcy of the shoulder. In this, one more point that I would like to add is, because of apart from these doshas, another structure considered as the Mamsa Dhatu. So if you correlate it with the modern perspective, you see a person with a frozen shoulder is eventually, if you observe the shoulder joint, we can see that eventually the patient will be having a wasting over his muscle tissue, over the shoulder region. So it is because the patient is not moving the shoulder joint because he is afraid that he will be having pain. So eventually what will happen, that muscle tissue will start, so slowly it will become weakened. The muscle weakness will be there. So the another line of management that we plan is to strengthen that muscle tissue and to increase the mobility. So for that we go on treatments like Nasyam, in which we instill medicated oil through the nostrils, and apart from that, we give nourishing medicines for the upliftment of the shoulder joint.
Okay, like?
One thing that we can do is Karpasasyadi Thailam.
Okay.
Karpasasyadi Thailam is used for the Nasyam purpose. In the initial stages, we don't prefer Thailam. We usually go for Rukshasvedam, means hot and dry warmth will be given for the shoulder, so that maximum blood supply is given to that particular joint, so that the joint become more and more mobile and more active, and the muscles don't get deprived of oxygenated blood. So first we have to give for Rukshasveda, warm sedations. Then eventually we proceed with at the final stages we will be proceeding with strengthening therapies like Nyavarakiri or Mamsakiri, etc. That's what we use.
So what about the Siddha medication?
Siddha medication, as the doctor said, we used to give Podithimertal. That is the Rukshasya, the doctor tell that term. In Siddha, we used to give Podithimertal, that is rubbing that area with powder massage.
Okay, medicated powder.
Yeah, medicated powder massage. Sometimes we give Otradam. Otradam means hot water fermentation, some medicated water fermentation, some kiri is there. And with that, we give some nasya preparations like Chukutailam. Like that medicines we use to nourish the nervous system also, we give some nasyam. Followed by that, we used to give oil soaking Otradam.
Okay.
Followed by that, kiri preparations also we will do. So one of the most formula medicine what we used to is Mayanathailam. After the Rukshasvedam, we used to give a Mayanathailam preparation over there. Then internal medications like Armuga Chanduram, Amkura Churnam, then Panjatipakni Churnam. These all we will add on to that, depending upon the temperament of the patient and Nadi. Only after Nadi diagnosis we will go to the treatment. Because some patients may have increased Kapha dosha, some may have increased Vata dosha. Basically, we used to correct the pranic flow over there. Actually, 108 Vama points are there in our body. But main Vama points stimulated over there is 8 Vama points. So first we used to give stimulation to the main Vama points, and last we do Adangal procedure.
Okay.
So within 10 days or 14 days, we can able to cure 80% of the frozen shoulder issues. As doctor said, initial stage if patient came to us, definitely we can able to treat them within 7 days. But majority patients are coming after the complete weakness of the muscle. That is the main issue that we are facing nowadays.
Okay.
And with that, we will used to give some exercise therapy also. Ladder stepping exercise therapy. We want to we instruct them to just mobilize the joint. After the procedure, they have to do daily regular exercise. Otherwise, the issues may reoccur again.